pre-existing conditions will not determine whether or not you have access to health care. That if you suffer from diabetes, and in communities of color, where there's a disproportionate level of these very chronic diseases like diabetes, obesity. This is one of the most obese neighborhoods in the city. Our young people, our kids here, are probably more obese than any other neighborhood in the city. That's a problem. You have childhood diabetes, you have asthma, all that leads to absenteeism in school. It's all connected. And so if you have an illness such as diabetes, you will not be able to be turned away within the affordable health care. And we held 3 meetings several weeks back, one in Harlem Hospital, one right here in New York Presbyterian, and another one in Montefiore, because the district goes all the way up to the Northwest Bronx, to Moshula Parkway, to Gun Hill Road. The other piece is, we'll try to get to everybody. The other piece is that our young people, our kids, and we know sometimes they stay a little bit longer than they should, right? But they now could be under the same umbrella as the parents, right? In New York State, through 28 years old. But what many people don't know is that Obamacare injected plenty of resources, dollars for Medicaid, for Medicare, and that funding for mental health services, which was always spotty, was really covered. That funding even for substance abuse prevention and the whole opioid epidemic that we're having across the country was covered. That lots of money went into those 2 programs, right? Medicaid and Medicare. And so folks think that it's just about pre-existing conditions and having your kids on the same plan as you are, but it really helped poor people as well, because more resources were allocated for Medicaid and Medicare. And so dismantling this now, and there's 20 million people, there's another 10 million people that were in another plan that are now in Obamacare. So in total, there's 30 million Americans that are benefiting from this important signature project by President Obama, because it was attempted even by Hillary and a bunch of folks and the American Medical, where am I, in New York Presbyterian Hospital? They always objected it. And now Obama comes with a Congress against him, and he passes this historic piece of legislation. And now, of course, because of political reasons, right? Not even on the merits of the argument, because of political reasons, they want to dismantle that program now and embarrass him. And so, if you do this, you got to have a replacement, and they don't. They just don't. And that's why you see that they're putting the brakes on Obamacare, and the debate has shifted to national security and immigration and the Muslim ban and other things, because they're not ready to act. So we got to continue to put the pressure on and let them know that we support Obamacare and that we support those provisions. We need to continue to do that. Please, if you can now focus, I know that you have some questions regarding emolument, but if you can now begin to shift your focus around ACA, that will be with the hat, okay?
This district has historically been part of the CBC, and I know you've been trying to become a part of the CBC. What can we do to help you with that?
This district has been part, I'm sorry.
The Congressional Black Caucus.
Oh, yeah.
What's going on with you
Oh,
and the
okay.
CBC?
Wow. Oh.
Not asking about the Canadian broadcasters.
Okay. Well, if you know Caribbean history, you will note that unfortunately, native Caribbeans, Caribes and Taínos, were wiped out relatively quickly by the conquistadores, right? Primarily because of tuberculosis and the diseases that they brought from the old continent that they could not combat. So the color of my skin cannot be traced, I believe, to Taínos or Caribs. I think I'm a Latino of African descent. And as such, I think I have the right to be part of both the Congressional Hispanic Caucus and the Congressional Black Caucus.
question is, how and when will she be censured or punished? And when?
Could you repeat it for the attorney? Can you repeat it, please? I'm sorry.
In regards to Kellyanne Conway and her inappropriate remarks about the Ivanka Trump brand, when will she be censured and how?
Specifically, which inappropriate remark are you making?
She advocated for people to buy Ivanka Trump's brand after Nordstrom threw out.
Right, so that things like that bring up several issues. Obviously, First Amendment, freedom of speech, that's one side of a complex situation there. And how that can go on to an emolument is if the president or someone in his family is going to be bettered or receive higher compensation due to things like that, that could absolutely be part of the argument that the emolumentation clause is being violated. But just saying something, strictly just saying it, will not be enough. Something needs to happen, an injury needs to happen.
Didn't she violate the law?
She was speaking for the White House.
Did she violate the law?
She was said in a free commercial. That wasn't about the emolument. Yes. About what punishment she would get for violating
she would get
ethics.
Personally, I don't know what kind of charges could be brought against her, what she violated, but I know regarding emolument, that does not apply.
All right. Okay, let's try to focus. I know that the emolument clause is a good one for us to discuss, and I promise you that the next meeting that we have, we're just going to exclusively deal with that, right? It will be in a bigger room. But if you can now concentrate your questions around ACA and Flynn and national security, I would appreciate it. Yes, yes. And immigration as well, yes.
So I think that part of the reason this room is so full, and part of the reason I now have your office on speed dial when I didn't 3 months ago, is because things have changed, and I think we're all feeling very scared. We're scared in the way that a bear acts when it's scared, which is that we're waking up, we're showing up, and we're acting. Part of the reason we're scared is because the law has not changed very much, but the way it's being carried out has. I'm talking about the racism, the Islamophobia, the sexism, and the just general un-American values that are expressed by ICE, that we saw by Border Patrol during the Muslim ban, and I'm wondering what you and what we can do about the culture that has taken over our federal government and is affecting every single one of us.
It's very serious. When I went to JFK when the Muslim ban was originally implemented, and I went to Terminal 1, where I was instructed to go, and the families there were 3 families there, right? There was one that was waiting for a niece that was a PhD student at NYU, and they had the ability to get the university to vouch for her. There were 2 other families, both of which were military families. The son of a mom, right? A military member of the U.S. Armed Forces, whose mother was coming in for the first time with her green card. Okay? So the welcoming that she got was that she was detained and questioned. Now this guy was so, I felt, I didn't know how to express how I felt about him, because he was such an American, if I could use those terms, that he didn't want to speak to the press. He didn't want to make any statements. Obviously, he wanted his mom out. What he did was he called his superiors in the armed forces to instruct him as to how he should proceed. And even with that, when I went in to speak to that, I got surrounded by the patrol the officers. No information whatsoever. In a little room with a plexiglass, it looked like a jail. The second family, eventually we were able to get the mom out that night. The second family was an aunt who was also coming in for the first time with her green card. and her nephew was also a member of the armed forces. 2 of them. And the families were there. And so if anybody thinks that's America, you should go back to Sister Mary, who was taught your history class, because that's not America. And so it's not just that. It is the behavior. We're going to meet with ICE hopefully next week. You know, we were going to meet with them yesterday, the day before yesterday, and we were not allowed to go into the leadership meeting with Ryan and Pelosi. But we will be meeting with ICE to discuss how are they proceeding? Are they proceeding within the parameters of the law? Or is it that they hear a president speak in certain terms and they feel they can just get away with anything? And so we must be vigilant, and we must know what our rights are. We must know, now I'm an immigrant, you know, and I came here with no papers. And so I know, even as a young boy, I knew what it was. My grandmother told me, you see a guy with a trench coat and sunglasses, don't get near him, that's a migrant. When I went to Albany, I thought they were still following me. I saw so many of them. Anyway, but you know, I don't want to make light of this because this is very serious.
Well, I think the enforcement of the law and making sure that these institutions are following the law is something that we're going to ask you to make sure is happening.
Yes.
And you need to tell us here on the streets how we can help with it as well.
And there is, as I said before, there is a long list of pieces of legislation that have been introduced, including I'm contemplating something similar to the CCRB, a civilian complaint arm, so that if you're mistreated, you can report that officer somewhere. When the officer knows that you're going to report him, it may alter his behavior or her behavior. And so there's a host of pieces of legislation that are floating, that have been introduced, that I think address what you're talking about, and I'll be willing to share it the next time around. In the middle like that, yes.
Congressman, thanks for your time. When the budget process begins in the spring, Republicans are likely to introduce a lot of policies opposed by the people in this room in the form of riders on a must-pass spending bill, such as dismantling the Affordable Care Act, or weakening environmental protections, or implementing new punitive immigration policies. What I'd like to know is, what are the policy red lines which you will not cross, where if they're included in a must-pass spending bill, you would vote against it even if it results in the federal government shutting down?
We have a problem. Houston, we have a problem, right? And this is the problem that we're facing as a party, right? The minute we engage Trump on what may be perceived to be positive things, let's say infrastructure, right? Nobody could really be against extending the 2nd Avenue subway, the Gateway project, a new LaGuardia airport. Who's going to be against it? But the minute, we need that one, right? The minute we engage him, we legitimize it. And the next step, he could be assaulting women's rights, or he could be implementing very tough immigration laws, right? So I'm part of the equation that says I'm going to fight them in everything, every inch of the way, I will not make them a little bit more acceptable to you guys, because at the end of the day, who's going to hurt all of us? All of us. I'm willing to do that, yes. Although, let me say something to you. Traditionally, shutting down the government has only benefited one person in the executive. Traditionally, right? Historically, shutting down the government has really worked against the legislature and has benefited the executive and has propelled that person beyond, you know, what may be perceived by the general public to be pettiness, right? And so, you know, we got to be sort of like very cognizant of that, because there are short-term victories, and I think we're doing good. I don't think we're doing bad. You know, he could have steamrolled us, but America is getting up. You know, women got up with the march, immigration issues got us up again. You know.